cancer prevention news. You've quit smoking. You've lowered your risk of serious illness. That's the good news. But you are still at risk of getting sick from smoking. By quitting smoking, you'll breathe easier. You're less prone to respiratory infections, and you have lowered your chances of developing heart disease, emphysema, and cancer. Whether you currently smoke or not, your risk of cancer and many other chronic illnesses is influenced by how much and how long you've smoked. Over 50% of all lung cancers are found in people who are former smokers. As a former smoker, what can you do? In the past, chest X-rays were used to help find lung cancers. Unfortunately, X-rays cannot see lung cancer early enough to make a difference in treatment outcomes. Dr. Martin Mahoney at the Roswell Park Cancer Institute.
Chest X-rays are valuable, but they are not sensitive enough to find early lung cancers. We often see a mass on a chest X-ray, but by the time you can see it on a chest X-ray, it's often very large. The problem with chest X-rays, they can't see small changes.
Fortunately, a new imaging technology called spiral CT scanning allows us to see what and where X-rays could not, catching lung cancer, in many cases, early enough to treat it.
Low-dose spiral CT scans allow us to find lesions in the lungs. We refer to those as nodules. Most of the time the nodules turn out to be non-cancerous, so benign, but some of the time they are early cancers. What we do when we find the nodules is set up a schedule to follow them going forward. It may be 3 months, it may be 6 months. Monitor growth. When they reach a certain size, we would propose a biopsy to understand what's going on. We're on the outside looking in, watching for changes in size or shape which would be suspicious for an early lung cancer.
The National Lung Cancer Screening Trial was a very large study of high-risk current and former smokers between the ages of 55 and 74 who had accumulated 30 or more pack years of exposure to tobacco smoke. Some of the study group received annual spiral CT scanning exams for 3 years. Others in the study group had received chest X-rays. The study found that the group who received spiral CT scanning had a 20% lower risk of dying from lung cancer and a 6% lower chance of dying from other smoking-related causes. The reason? Lung cancer was detected early enough in the group that was offered spiral CTs. For those who were found to have cancer, treatment outcomes improved. How do you know if you qualify for spiral CT scanning? If you have 30 or more pack years of smoking, that's at least 2 packs a day for 15 years or 1 pack a day for 30 years, you should contact your doctor to ask if spiral CT scanning is right for you. The test is painless. It takes about 30 minutes and many hospitals are equipped to perform the scan. Ask your physician about a referral to an experienced screening facility. Also ask about insurance coverage for spiral CT screening for lung cancer. As a smoker, does this mean you don't have to worry about quitting? No. Stopping smoking is still the surest way to avoid cancer of the lung. However, if you've smoked a lot of years, talking to your doctor about screening is also now something that is important for you to do. Do it now. If you smoke, call the Quit line for free support and medications to help you stop smoking. Your life could depend on it. For more information, call 1-800-QUIT-NOW. That's 1-800-784-8669.